Good evening, class and professor. I am presenting to you tonight my reflection and my outline of the case studies that I wrote about in my paper, Reflections on Ethical Behavior. In my reflection, these case studies and this course has outlined my career pathway. Depending on which of the many public health disciplines I choose to embrace academically or professionally, I have received a high level of public healthcare education regarding management and administration of programs and personnel from National Louis University. In summary, my leadership role will provide admirable respect and passion in helping others in healthcare and healthcare policy for the masses. This course has sharpened and developed my leadership skill and overall ability to formulate and perform the tasks needed. The truth is, public health is a dynamic field and rewards those who can adapt along with the scientific, economic, and political landscapes. The abstract of my paper details healthcare professionals who often face complex ethical dilemmas in the workplace. Some professionals confront the ethical issues directly, while others turn away. Moral courage helps individuals to address ethical issues and take action when doing the right thing, when it is not so easy. This paper and this presentation outlines case studies from the textbook Legal and Ethical Issues for Healthcare Professionals by George D. Prozar. These cases contain a multitude of legal and ethical issues. I will attempt to explain what ethics is, the importance, and its application to ethical dilemmas. There have been many contradictions related to the Code of Ethics. Depending upon what state or country you live in, the ethics and code of conduct in healthcare, professional organizations, hospitals, scientific research, advancements have endured great difficulty in handling sensitive situations in a consistent manner. There are many gray areas that make some decisions difficult and make correct choices difficult that are not always obvious at first. Receiving medical assistance is personal, perhaps the most personal of any service any one of us could receive in our lifetime. There is a need to recognize its importance and to know that our healthcare delivery system has ethical and legal integrity. There are specific criteria that our medical society is required to provide. As healthcare administrators, doctors, and nurses, awareness of this ethical and legal integrity is crucial. That information, however, is not readily accessible for the patient and or family members that might need this resource. It is our legal and moral action of the medical practice world that makes these individuals inherently responsible to make sure that the patient is aware of all of their rights as they occur. Contemporary scholars more frequently address the act of moral courage as the commitment to stand up for, act upon one's ethical belief. Moral courage is vital to the willingness of individuals to take hold of and fully support ethical responsibilities essential to professional values. Moral courage is highly esteemed and is a highly esteemed trait displayed by individuals who, despite adversity, personal risk, decide to act upon their ethical values to help others during difficult ethical struggles. An essential virtue for all healthcare professionals. We now come to Case Study Chapter 1. Can the physician change his or her mind? According to the consent presented, physicians may reserve the right to change their mind and make decisions based on the patient's physical state, well-being, and condition at the time of surgery. This change was not immediately communicated in this case study. In my opinion, the breakdown in the moral compass fell to the floor. If the doctor could not perform the surgery in the manner in which he described on his preoperative note and consent with the patient, he should have immediately postponed the surgery and had a conversation with the patient and or family member regarding this issue. Legally pursuant to the Patient Self-Determination Act of 1990, patients have the right to make their own healthcare decisions, to accept or refuse medical treatment, and to execute in advance healthcare directives. Looking back on this case, the court erred, directing the verdict in favor of the doctor. Moreover, there was no possibility of a life-threatening situation looming in this procedure. This surgery could have been delayed based on the doctor's findings. The doctor should have used moral judgment and given the patient the opportunity to make the decision rather than making it for him. Case Study, Chapter 12. A patient's refusal to treat. This is a very difficult case. The court ruled in favor of the hospital, stating that the child, less than 3 months old, was unable to advocate for himself and was at risk of substantial and immediate physical harm. Although parents have fundamental liberties when it pertains to their children, but it is not absolute when medical necessity is present. In this case, the hospital's moral courage was very apparent. I am facing a similar situation in my personal life. My father-in-law has stage 4 bladder cancer and has been challenged with multiple organ system failure. His new wife of 10 years is a Jehovah's Witness, although he is not. This conversation with him is particularly difficult because he is unwilling to communicate. If informed consent was not completed before an emergent situation arises, and consent in the form of an advance directive hasn't been given to another blood relative, the only way the hospital would be able to override the wife's decision not to treat is if there is prior documentation stating otherwise, signed by the patient. This issue happens more often than not because you have a husband and wife who is bound by marital law. Things get very tricky. Case Study, Chapter 10. Questionable medical history conducted. The patient's physician did not complete an H&P form prior to surgery. The patient's nurse documented on the assessment form that the patient had a history of ischemic attacks, diabetes, and hypothyroidism. The anesthesiologist was not aware and administered anesthesia without knowing the patient's previous history. Is this negligence? Is this ethical barriers? I find this case very disturbing. It is my recollection that each patient admitted for inpatient care should have a completed admission history and physical examination recorded by a qualified qualified medical staff or physician. However, in reading articles and finding that the Joint Commission and Centers for Medicaid and Medicare Services have a law by which reads like this: a physical must be completed and documented for each patient no more than 30 days prior or up to 24 hours after hospital admission or surgery, whichever comes first, according to the Joint Commission and Centers for Medicare and Medicaid Services. That is a very disjointed bylaw because there is a huge space in between the amount of time that you are an inpatient and a very short amount of time that you could have surgery. Therefore, honestly, 24 hours after hospital administration most often is after surgery has been performed. I think it is highly unethical for healthcare professionals to risk their patients' health because of their laziness and negligence in hiding behind this rule. Communication between doctors, surgeons, and patients in routine office visits, I thought was a necessity. It obviously is not. In summary, my abilities to understand ethical behaviors better, to put forth legal acts and bylaws, and to understand the importance of having ethics at every juncture in healthcare was very interesting. In the movie with Robin Williams, he performed so many ethical blunders. And at times, it was at the risk of patients. But it was his passion that he didn't feel he was making the wrong decision. I find that very interesting because I'm quite sure that residents and pre-medical students have been there and have been the Patch Adams of their class. I think that passion and empathy and sympathy have to be somewhere in the healthcare field. It can't always be at the point of making decisions, but it does need to be present. That concludes my presentation. Thank you and good night.